Hi, we're making this video on the fly because we wanted to answer these questions. We've got two emails which other people can also find very interesting. So I have a question for the webinar next month, which we're actually going to answer again. How dielectric material affect the spark output? Basically, the dielectric material is what we call is air normally if you don't use any gases. This applies to Dielectric and most devices out there. So if you then apply other gases like argon, other inert gases and so on, then things are different. But if you only have the air as a medium, which is the case for most devices, which is the dielectric material, then the spark is going to be pretty much very similar. Now we're going to go and have a look on the seminar at this particular device, whatever you can find online. But I suspect it's just another marketing thing. So what it says here, machines like black spot, loose voltage, plasma pen, penny plus supposedly have this feature, and they say it hurts less and make a shallower spot. Is it true? We have to look at these devices, but I mean, based on the experience which we seen since 2012, people try to come up with supposedly unique things, but then you just look into that and then you find there's nothing unique. So it's very likely a marketing thing, but we're going to investigate into that a bit more into the Golden Training Seminar. Then we've got another question here. I'm actually opening it up now. Here I've got thanks of the video. Found some salons in the UK that do lasers and arcing. I'm still trying to make up a pricing list for the treatments that I will be doing in my place. Next set of questions that I have after rewatching all of the videos on stretch mark treatment, I just want to verify that I understand the protocol. When treating stretch marks, you're going into the body of the mark, the white line, yes, that's correct. Not the edges, correct? Yes, indeed it is correct, but you can actually go and do a bit on the edges as well. It's not as if you have to limit yourself to the white marks, but if you just go over the edges of the white stretch marks, it shouldn't be a big deal anyway. That won't make them deeper, correct? Basically what you're doing with this, with the electrical arcing, another thing that we've designed a new device. On stretch mark treatments, what we're doing, we're really applying skin resurfacing. So really, if you're doing it right, you shouldn't. If you go to DPS, indeed, you're going to cause scars. And then we're going to talk about skin resurfacing using our new device in other videos anyway, which we're making right now. Unlike atrophic scar removal, you want to be on the body of the stretch mark, right? Yes, indeed it is. It is correct. Does it matter if the marks are white or purple? I've always seen them white. I'm not sure about purple marks. Maybe maybe because they're newer, they're just being formed. It's possible. So I'd say just sticking with the white ones. New stretch marks are sometimes raised. Is it okay to treat them the same way? How far apart should you space the treatments? Now, if they're too fresh, I'd leave them alone, personally, because they're still changing and redeveloping. So you would actually want to wait until they're completely they stop developing so you can treat them. How far apart should you space the treatments? In the region of 6 weeks to 2 months, I would say, to be on the safe side. So and then if you find that the area is still a bit sore or tender, just leave it alone for a little longer. So hopefully this is going to be helpful, and we're going to post new videos. At the moment we're actually working on making we're actually shooting more and more videos, which are going to be released later on over this month or next month. Actually, over the month of May. So thank you for watching, and keep your eyes out for the new videos that we're going to post on our YouTube channel.